Hi, my name is Mark Longbottom. I'm CEO of Heart Kids New Zealand. I'm pleased to welcome Dr. Tom Gentles to today's chat. The main purpose of this conversation is to discuss Ward 23B's approach to the lockdown in its current format in the middle of August in Auckland and also nationally. So welcome, Tom, to the call, and thanks very much for joining me.
Thanks, Mark. And I've got Yvonne and Mandy, who are nurse specialists. Many of you parents and families will know Yvonne and Mandy from telephone conversations and face-to-face meetings over the past few years.
Yeah, great to have all of you. So the government announced a further lockdown period due to COVID-19, which means an uncertain time for all New Zealanders, particularly for Aucklanders. But very specifically for our heart kids, heart families, in terms of the effect on them. And so I'd really like to hear the current status of Starship and Ward 23B. What's the approach to care and services?
Yeah, well, to some extent, Mark, things are changing day by day. And certainly we had the first few days last week and we weren't quite sure what was going to happen after that. And now that we know that we're in lockdown for another 10 days or so, then at least I think we've got a bit more planning to do over the next little while. But essentially where things are at the moment is that visitors are being screened as they come into the hospital. They're being given a mask to wear, and there's been some restriction in the number of people that can visit when people are in the hospital. I don't know if you want to speak to that, Mandy, about the visitor restrictions.
Certainly for Ward 23B, we're limiting the amount of visitors coming through. So really it's just, one parent is able to be on the ward at a time with their child. Sorry, dress is falling off there. Whilst the other parent or caregiver is able to do a swap around. So we're not saying that two parents can't be with their child, it's just not at the same time.
And I guess the other aspect you might have mentioned, Mandy, is siblings too. We have restricted sibling access to the hospital. This isn't specific to 23B. In fact, this is the policy of the whole children's hospital at the present time. And there are certainly exceptions that can be made to that on compassionate grounds. If there's a change in status of the child's condition when they're in the hospital, or if there's information that really needs to be shared with both parents, then the policy is adaptable.
And so deadline for us is next Wednesday, and further announcements from the government, and potential to stay in level 3, I guess, move to level 2. What sort of planning is involved for you guys as we head towards that announcement?
Well, there's a lot going on in the hospital, and I think at the moment that the community spread is perceived to be relatively minor insofar as we know, and for that reason the hospital's staying open to semi-elective and elective appointments. It's really important for us that we continue to see children who have heart problems, because there's a risk of leaving things too long and not treating people in a timely way. So I guess there's a bit of a balancing act that's going on in terms of how much community spread there is, and of course not wanting to leave important problems to drift on when that could be detrimental to children.
And in terms of a piece of advice to heart families for their heart children, what would that be they can do in their communities and their homes?
Well, I guess the main one is to have the flu vaccine if you're eligible for that, if you're able to have that, and that's really to avoid the potential of getting two bad things at once. And otherwise, I think most of the advice we'd have for heart children is similar to the advice we'd have to other families.
And in terms, as a director of clinical services, you guys, the rest of the team, is there anything that keeps you up at night in terms of COVID and delivering your services?
Yeah, we try and get a good night's sleep, Mark. You know, certainly, I think what we are worried about is if this thing gets out in the community, that it will be hard to bring children in who need treatment. And I think that's the concern we have. We're really fortunate in that with most things, we've caught up really nicely after the last lockdown. So we've had a few months where we've been able to ramp up our clinics, ramp up our procedures and surgeries. You know, I'm sure most heart parents know, but we have now recruited a third cardiac surgeon, Johan Brink, who came over from Melbourne just before Melbourne got locked down, literally the night before. And he and his wife and his young son spent 2 weeks in quarantine in a hotel, and he started work about 2 weeks ago. So you know, we have a full surgical contingency now, which we haven't had for a couple of years. And I guess our main worry is that if things do get a bit out of hand, then it may be hard to bring people into the hospital.
And in terms of inquiries to you, because you're really conscious that you're a really busy team, as always, which channel would you like people to direct their inquiries to?
They should direct inquiries Monday to Friday to the new specialist team, and after hours if it's urgent, and they can direct them either to the ward, or they should seek medical advice through their, you know, through emergency department or emergency clinic.
That's great. And if you go onto your website, I've looked myself, there's full explanation of the individuals in different roles, and also contact emails for different parts of the service as well, isn't there, which is great.
Absolutely. And we've written some guidance that I think Tom's happy to share as well, so we can send that through to you as well, Mark.
Yeah, we'll put that on we've already put some guidance this morning actually, which you shared with us on Friday. We'll put that on our website so people can look at it there. But as updates, our plan is for updates become available from you. We'll share them on the Heart website, Heart Kids website as well. So really thanks. I don't want to hold you guys for too long. I know you're really busy, but thanks for joining me, and really appreciate the updates.
Thank you.
Thank you.